Illinois and the Illinois Department of Public Health. Health Huddles is a partnership. We are bringing everyone at home the latest essential information you need from one of our most trusted departments, the Department of Public Health, as well as our friends and professionals for the betterment of older adults. Today, AARP is proud to introduce our special guest, Dr. Hillary Spencer. She is a medical doctor, has a master's in public health, and she is the infection prevention medical advisor for the Illinois Department of Public Health. We thought it'd be great to discuss two respiratory viruses for today's event, the flu and RSV, and how to protect yourself and your loved ones going into fall and going into winter seasons. There is a lot to unpack, and we have the guru with us, and so we're going to start going into questions. But first, I want to say welcome, Dr. Spencer, and thank you for having. And if you're joining us live, if you're on YouTube or you're on Facebook, we are monitoring the comments, and we want to hear from you. So Dr. Spencer, welcome. And let's just start off with the basics. Can you help listeners understand what is the difference between RSV and the flu if it feels the same? What's the difference?
They are two different viruses, and they can cause similar symptoms. They're both respiratory viruses, causing respiratory illness and lung infections. RSV is one of the viruses that in otherwise healthy adults usually causes the common cold. It's been known for years that RSV can cause severe illness in very young children, but it's only more recently, with more widely available testing, that we've recognized just how common RSV is in adults and how much severe disease it can cause in older adults. RSV causes 10,000 hospital admissions in people over 60 years every year. The flu is caused by one of the influenza viruses, so it's a separate virus, even though some of the symptoms are similar. Sometimes people call a stomach illness the stomach flu, but influenza, the virus that causes a respiratory illness, is not the cause of this kind of illness. So it's not the stomach flu, it's totally separate things. The flu or influenza causes a respiratory illness that ranges from a more mild illness with runny nose and cough to a more severe illness with high fevers, severe body aches, and a severe viral pneumonia.
Okay, so let me ask you this real quick. So if I had RSV in the beginning, and would it be an indicator if I had a high fever, or is that just something that we see with the flu?
The flu tends to cause higher fevers, but really you can't tell the difference between the two without testing. There might be some indications, some things that lead your doctor to suspect one over the other. But really you need a test to know for sure the difference between the two.
Okay. So again, you got to walk me through. You walked through a little bit for me, but so Illinois has about 1.3 unpaid family caregivers caring for their loved ones, caring for their wives or grandmothers, and AARP residents of 50 plus in our state. If you're a caregiver and you see your loved one starting to get sick, can you go over for me what are the symptoms that would be, okay, this may be RSV, this is serious, I need to get it tested, or okay, this is the flu, we've been around the grandkids. Again, what are kind of the big flashing signs like RSV? We have an issue, flu, we need to call the doctor. What's the symptoms again?
Sure, yeah. So the symptoms largely between flu and RSV can overlap. There may be some differences that lead your physician to think one more than the other, but really sort of you need a test to know the difference for sure. And the symptoms of flu and RSV also, it's really important to remember, overlap with the symptoms of COVID as well. You can't know for sure just based on the symptoms that you're having which one it is. So the only way to know if you're having cold-like symptoms that are what it's due to is to, in certain circumstances, or that may be used, in certain circumstances. The important thing is if you're feeling ill and it feels like it's more than a common cold, is, if you think that you need to seek care, is to do that. If you should call your physician early if you're having symptoms, and if you don't have access at home to like a home COVID test to start with, you should, really call to check in if you're feeling particularly ill.
You made a great point, but calling and checking in. Our last event we had virtually, we talked with your leaders on ageism in public health. And what you said just makes kind of rolled into that. When you call, and what would you encourage individuals to say? So someone like, be honest, and over someone who's overworked, they're exhausted, and on the medical care side, like, okay, it's a cold, roll it out for 48 hours and call us back. But if you know you're seeing some symptoms that are unique, and now we're knowing there are testing for it, what do you say? Like, what do you, do you tell a family caregiver or someone who's 60s and 70s, say, no, I feel this is an urgent issue and I request to be seen? What would you be your advice to that individual?
hmm Well, I mean, I think that it's a question of, what's sort of going on at that time and what your personal history is. So certainly, having underlying conditions being, you know, having even greater age and having sort of frailty puts you at greater risk. So understanding sort of where you are on the spectrum and sort of what your sort of risks are is important, and that can be an important thing to talk with your clinician about. What are the signs and symptoms that I should look for with my underlying health conditions? Is it appropriate if it is flu or COVID? Should I be getting treatment for it? So those are reasons to be seen earlier, and your doctor's office can help you understand what's going around and whether it's important to test right now or whether you can wait based on your underlying health conditions and the viruses that are circulating. Depending on what's circulating also guides the testing that your physician may choose to do. Flu doesn't usually circulate, for example, in the summer, so we usually don't test for it, and sort of being seen quickly during the summer season when flu is not circulating is different than during the
Yeah.
winter season when there is flu. And your access to and ability to take a home COVID test may play a role in that too. If you've already taken a COVID test and you know that it's not COVID, you don't need treatment for COVID, there may be, depending on what's circulating in your underlying health conditions, may guide your clinician to see you sooner rather than later.
That's a great point. And talking about, so I want to jump in. You talked about testing. My daughter's 9, strep is going around. We took her to urgent care, and I have insurance, but we got the bill. And surprisingly enough, our COVID, I don't believe our COVID testing was covered. So it's a good tip if you have, and you can get the free test, you can be able to test at home. When you go in and you take a flu test or an RSV, we know what COVID feels like, right? What is a flu and a RSV testing feel like? Is it all in one? Is it a spit? Is it a nose? I mean, I remember COVID. I remember getting, tested really high up in my nose and I had to shake. But what's it like for flu and RSV?
Yeah, the early COVID tests were deep, and more than the newer tests, and in most settings are available, can be done sort of in the anterior of the nares, which is also true for most flu and RSV tests. Some of them are done in combination tests, so with one swab to do 2 or 3 viruses, and in some settings there may be need for more than one swab to test for different viruses, but it just depends on what is available, what resources are available in the clinic or lab or other setting that you're being tested for. But in general, the test is not as invasive as those early COVID tests.
Yeah.
Nobody likes to have their nose tickled, but more the tests that we're using more commonly today are usually more the tickle than that feeling of having your brain poked.
Yeah. It was quite enjoyable. Let's just put it that way. What about, so in Illinois we have a tremendous number of grandparents raising their grandkids. So they're caring for them, kids come home. Is the testing the same for kiddos for an RSV or the flu? Is it the same test or is it different?
The same tests can be used on people of all ages. It just
Mhm.
depends on what's available in that setting, what test will be used. Every office and lab and sort of clinical setting may have access to different kinds of tests
Okay,
or different
great.
brands.
Yeah. Okay. So, what is, if you're a healthy 60-year-old with no major underlying health conditions, what's a ballpark? How long does it take to recover from this, right? What can we have as the end zone saying, okay, I'm going to suffer for 3 days and I'm going to start feeling better?
Yeah, so some healthy adults may recover from the flu in a few days, while others may take up to 2 weeks. The recovery time for RSV is similar. Sometimes cough can last longer than those initial acute symptoms. That often gets people concerned when the cough is still there, even though, they're not feeling as run down, they're not having fevers, but the cough lingers. So it's important to know upfront that that can happen. For me, it seems like the cough can last a month sometimes after I get a cold. Um, Even healthy adults, though, can suffer from a more severe infection with both, with either flu, RSV, or COVID, that can lead to hospitalization, and recovery from that can take weeks to fully recover. So even though somebody may be, uh, 60 with no other major health conditions, most of the time that will be a few days to a few weeks, but some people can have, severe infection and may be hospitalized even when they're otherwise healthy. That's less common. The people who are more likely to have those severe consequences are more likely to be, even older or have other underlying health conditions, but anyone can have those more severe consequences, which is why it's important to, sort of pay attention to your symptoms and know that hopefully it will be over in a few days, but if it's getting worse, it's important to be seen.
And go back. I'm gonna reaffirm, communicate with your healthcare professional and talk with your loved ones and prioritize your health or your loved one's health and do what's best for you. I definitely agree. So I want to go, you talk about severe symptoms. What would be and I may have already asked this, what's the emergency signs? Like, wow, my mom's 70, she's been coughing, she's a little, but it's just not going. Like, she asked for coffee this morning. She never drinks coffee. That's not right. Like, what's some of those kind of triggers that we have to take our loved one in immediately to the emergency room or, make an appointment now with our doctor?
hmm Great question. In adults, warning signs can include difficulty breathing or shortness of breath, pain or pressure in the chest or abdomen, sudden and profound dizziness, and confusion. Some older adults manifest their symptoms as just severe fatigue. And it can, these conditions can make your underlying heart or lung conditions worse. So it may feel like your heart failure symptoms are worsening, that you're having a COPD flare. Another sign to seek care is if symptoms improve but return with fever and worsening cough. This may indicate that there's a bacterial infection complicating recovery. Not always, but sometimes. And so if you get a little better and then get worse again, that's another indication or reason to see your clinician.
Mhm. And, if you have COPD, right, you're already kind of your respiratory is compromised. I would imagine this trifecta of flu, RSV, and COVID is a really shaky, future you have to be very mindful of. What can you do to protect yourself now, being healthy, from flu and RSV?
So yeah, I think we're in an exciting time in terms of having vaccinations available. Particularly, I think that's one of the most important early prevention, measures. We have the new COVID immunization for the fall. We have the annual flu shot available, and new this year is an RSV shot for individuals over 60. And so I think those are the sort of the first lines of prevention to avoid or reduce. None of the vaccinations completely eliminate the risk of getting a virus, but decrease the symptoms in general for most people and decrease the risk of severe complications like hospitalization and death. So vaccination is one of the most important prevention measures. Outside of that are really sort of back to the basics, being aware of where you're coming into contact with more sick individuals, staying away when you're sick yourself, communicating about that with others, and sort of making sure, I think, as we're coming into family gatherings, that we're all a bit flexible about who may be able to join those,
Mm,
so that we're not sort of putting pressure on people to join when they're sick. If we're going to be out in public when viruses are circulating, I still wear a mask when I go
okay.
out, because even though I don't have underlying conditions, I don't have time to get sick.
Mhm.
So I still wear a mask. That's a great thing when you're out and in crowded spaces. Another thing you can do in your own home is see what you can do to improve home ventilation. So especially as people are gathering more indoors because of the cold and with the holidays coming up, the CDC has a great ventilation tool that you can check out online to see what you can do to improve your home ventilation. On these days that are a little bit more mild, you may crack a window to, let air circulate a little bit better. And then, of course, cleaning the environment and doing, hand washing or using sanitizer are all great things to help reduce the spread of these viruses.
So I'm gonna ask one question to follow up. We wore masks all during COVID. Tell me how. I always thought, and I'm probably wrong, a mask was to keep my germs in and filter potentially any germs coming in. Give me a layer of protection. Is that still the rule of thumb?
Yes, yes. It reduces your risk if you're sick from spreading, and it can also protect you from those droplets too. So
Okay.
I think that there are different kinds of masks, and each provide sort of a different degree of protection, and you have to decide sort of what's right for you in those circumstances. But the masks can be helpful with these viruses too,
Right.
as well
And
as
if you
with
choose.
COVID. Yeah.
Yeah. I just went to DC and especially being a plane and airport, I saw a lot of people wearing masks and it kind of gave me like, it's maybe a thought. Like it was just kind of got out of my thought process. But so here's a good one. I get this a lot when people ask us when we're doing these conversations. When do I get my shots? Right. So I'm got Thanksgiving. Do I do it 2 months in advance, or do I wait till I go on my cruise in January and really do it December 1? So when would you tell individuals that are 50 plus to get scheduled RSV, your COVID if you choose, and flu? And here's the caveat. Do you do it all at one time, knock it out, or do you schedule them out? What's the best game plan here?
Yeah, the best time for most people, including older adults, to get their RSV and flu vaccinations is before the onset of the season, before these viruses are circulating. So that's recommended to do in September, September and October. So it's this time. If you
Yeah.
haven't already gotten it, go and get them. This is to give you the protection and to let your body form the antibodies before you come in contact with the virus.
Mm,
Um, so that's the best time to get it. If you don't get it in September or October, get it as soon as you can. In terms of getting them at the same time, you can get all three simultaneously, or two, simultaneously. If they're given at the same time, they should be given in either like separate limbs, like two different
okay.
arms,
Yeah.
or at least an inch apart between them if you're getting them in the same arm. Giving them at the same time can increase some of your side effects like fever, headache, pain at the injection site, but it doesn't change how well the vaccine works. So some people may choose to take them at the same time. I choose to get them at the same time, get them one and done, feel crummy for a
Right.
day and get it over with, rather than having 3 crummy days.
Yeah.
That's my preferred strategy.
Yeah. When I'm booked, I'm
Others
with you.
choose
Yeah.
Yeah,
I'm
others
sorry.
choose to space them out. Just sort of, I think it's important to be mindful of where you are in the season. If you're starting earlier in September versus, later in October,
Mhm.
you may give yourself more time. My parents each got two at the same time and then came back for another one. And that was just more based on vaccine availability. But in terms of when I recommended it to be done, this month, and they got it done earlier this month.
Wonderful. Well, I tell you, it's on my calendar. My daughters are going to get their flu shots today. They don't know it, but they don't mind because they get a sucker ice cream afterwards. So I hope everybody gets a little treat afterwards.
Yeah, treat yourself.
So treat yourself to some vaccines, guys. Okay, so the Advocacy Committee on Immunization Practices, ACIP, recently recommended the single RSV vaccine for those over 60. Um, so one, talk about that. Two, is this kind of like what we remember in COVID? Because when the COVID vaccines came out, wholly different, I know, medical care, but there was, you could get A, B, or C. Which one are you getting? And it became a conversation at the dinner tables like, oh, I went and got X vaccine named. This is better than your vaccine. Like, I remember being in these conversations. What about for RSV? Is there one vaccine? Are there multiples? Tell us about it.
Yeah, so for RSV, there are two shots that are available for older adults. One is made by Pfizer, and it's called a Brisvo. I think that's the pronunciation. They all these names that they come up with. The other is made by GSK, and it's called Arexvy. Both of these are similar, and they use a vaccine technology called recombinant protein vaccine. So, we learned a lot more during COVID about sort of different kinds of vaccines. This is not an mRNA vaccine. It's called recombinant protein. It's a traditional vaccine technology similar to, for example, the hepatitis B vaccine. They're both similar, and there's not a recommendation for one over the other.
Okay. So right now, is there any recommendations or is it available for RSV for individuals between 50 and 59?
So no, the vaccine is not recommended for individuals 50 to 59. This is because the greatest risk of severe RSV is to older adults with underlying health conditions and frailty, and the vaccine was studied in adults 60 and over. So as a side note, I will say, though, while it's not available to those 50 to 59, this is an exciting time in RSV prevention more generally, and there are two other populations who should receive RSV immunization. So Abrysvo, the Pfizer vaccine, is recommended for pregnant people 32 to 36 weeks of pregnancy during the RSV season, and this is to protect their infants. Infants are at high risk of severe outcomes from RSV. This is the population that we typically think of as being at the most risk of severe outcomes, and immunizing mothers can protect infants after birth. We also have another new tool to protect infants, and it's different than the typical vaccination because it's a monoclonal antibody, something else we heard a lot about during COVID. This one is given as a shot. And as a monoclonal antibody, it provides protection but doesn't stimulate an immune response. So those are two other things you may hear about in RSV immunizations and shots. Not for older adults, but it's important to remember because older adults getting vaccinated can help protect grandchildren, and the youngest grandchildren can help protect their grandparents. So something else to think about. It's a families protect each other.
That's right. That's right. So let's say the scenario, I get the flu or I get RSV or my mother does who's 70. What medications, right? We know that if you get COVID, you call your medical professional and you may be eligible for medicine. Is there the same thing for RSV or the flu to minimize the symptoms?
So yeah, for flu, there are several antivirals that are available outpatient. The most common are oseltamivir or Tamiflu, and there's a newer one called baloxavir or Xofluza. Everything has more than one name.
Yeah, of course.
They're recommended for people over 65, as well as those with some underlying conditions, people who are hospitalized with flu, and people who have a very severe flu illness. And ideally, they're started within 2 days of symptom onset, which is why when flu is circulating and if you're having symptoms that could be flu, it's important if you're somebody who could receive treatment to talk to your doctor early so you can get tested and get that treatment. And talk to them about whether it's appropriate. At this time, there are no antiviral treatments or other treatments available for RSV outpatient. And there are supportive therapies that are used when somebody's hospitalized, but this is one of the reasons why it makes it even more important to get the RSV immunization. There isn't a treatment or an antiviral to take at home for RSV.
How long does RSV vaccine last? We know the flu is per season. Is that the same with the RSV vaccine?
Right now, the recommendation is only for a one-time immunization or one-time shot with RSV. It does show protection that lasts 1 year and some protection that lasts a second year as well. And I think we will need more studies over time to understand how frequently, if it's needed more than one time, and how frequently it's needed. So right now, the recommendation is to get it one time at before the start of the RSV season.
Okay. In doing research, getting into this today's conversation, I found there's high demand, cost, infrastructure issues reportedly, and snags for the RSV vaccine program. Without insurance, it could be up to $500 a dose. Is the Department of Public Health finding this challenge happening in Illinois? And where's it like, is this trending in the state of Illinois? And then what's the best way if you and your medical professional decide that RSV vaccine is appropriate for you? How do you secure that appointment?
hmm as a new vaccine, there are sort of challenges and learning points about how to get this out. And there's, the supply has to pick up to get out, and it has been picking up. The RSV vaccine is covered by Medicare Part D prescription
Okay.
coverage. So you shouldn't have a copay if you have Medicare Part D and are over the
Mm,
age of 60, the population that it's recommended for. This is different than flu and COVID vaccines, which are covered under Medicare Part B. So
okay.
if you have an assigned case manager, I would say, reach out to them for assistance navigating this. This has been one of the sort of difficult points, is that it has a little bit different coverage. So it might be more easily covered in some settings like pharmacies than in other settings.
Yeah,
Um,
okay. Yeah.
the RSV vaccine is also covered by Medicaid. So if you have Medicaid coverage, then it should be, come with no cost. If you have a non-Medicare drug coverage, you should check with your plan about whether the vaccine is covered and where it's covered. There are sort of network issues around that. And this is a complex process, which is why, your advocacy is also important to make sure the vaccine is fully covered and eligible for all seniors, for all eligible seniors.
Yeah, yeah,
As I
yeah, that's
mentioned,
good.
oh, yeah, because the RSV vaccine is covered by Part D prescription coverage, it may be simplest. Some people have found it simplest to get the vaccine at a pharmacy. So when I just sort of looked online at different pharmacies for appointments, I found appointments available at many large retail chains like Walgreens and CVS. Just in the last couple of days, went looking before this to see, as well as many grocery store pharmacies. So there do appear to be appointments available. If you're not comfortable sort of looking for these online, you can call or drop in. Calling ahead makes sure, ensures that it's both available and that there's somebody available to give the immunization. So that can be a benefit. But we also all have to go to the grocery store or pharmacy at some point. So, if it's easiest, maybe just stop in and see.
That's wonderful. No, I appreciate you going through all of the breakdown of how it is covered, Medicare, Medicaid. That is such a big concern with individuals who want to be proactive, but they don't know if they're going to get a $500 bill afterwards. So I appreciate you walking us through that. And we have about 2 minutes, so I'm going to ask you two more questions. We have so many loved ones in long-term care facilities. We know what happened during COVID. We know about the isolation. So with RSV and the flu, and even with COVID, what is, as a caregiver, what can you do to have conversations with a nursing home facility or long-term care facility and your loved one there to protect them from RSV and flu this season?
hmm Yeah, these respiratory viruses are a risk in long-term care and in places where people are living and working closely together. So taking precautions is important. I think the most important thing, these viruses are often introduced from the outside. Like people who are living in long-term care aren't usually going out into the community to pick these up. So we have to be really mindful of bringing them in, which is why it's really important for visitors to be very aware and avoid visiting when visitors are sick. Even if you're having minor symptoms that you think are allergies, for example, put off visiting until you're feeling well. I think we've heard that particularly with COVID, but it's true for these other viruses. You think, oh, it was
Mhm.
just a little allergies and kind of ignored it. And a few days later, you realized. So we have to be really mindful for ourselves and really have a low bar for avoiding that until we're, have tested, until we give it a couple of days to see how we're doing. Because the introduction of these viruses into those settings makes one person sick, and then when one person is sick, there's a greater chance for it to spread. So other things you can do is when you visit, if you're asked to wear a mask, wear a mask. That could be because of the facility's policies, because of the transmission of these viruses in the community, or because of an outbreak that facility is having. So they have those policies in place for a reason. It may be different than what's going on in the rest of the community, but please be respectful when they
Mhm.
request you to wear a mask. You're protecting your loved one and all of the individuals that reside there. So The other things you can do are wash your hands, wash your hands, wash your hands. Those are kind of the basics, and get vaccinated, because having your vaccinations up to date protects your loved ones too.
Oh, this has been incredible. We have now gone through 30 minutes and I feel smarter than I've this whole season about this. I am thrilled. Thank you so much for having this conversation. And for all of you that have joined us and viewed, AARP has actually sent you information from the doctor on RSV and vaccines for you to have more resources on. So now we've come to the end of our 30 minutes. Dr. Spencer, again, she's the Infection Prevention Medical Advisor for the Illinois Department of Public Health, being with us today. We appreciate it. I know you have a very busy schedule, very hectic during this time. So for you to carve out and educate us, it's going to go a long way. We are grateful. And again, this is the second of our virtual series with the Illinois Department of Public Health on health huddles. And we hope that you continue to join us. We're going to be doing this for November and December, talking about caregiving stress and taking care of yourself during December and the holidays. So we are at our 30 minutes. We thank you again, Dr. Spencer, for your time, and all of your colleagues, Department of Public Health, that helped us bring this conversation. On behalf of the AARP Illinois, we thank you, and stay well and have a great